So today we're diving into the last chapter of the first week, chapter 5, the body as a whole. We're going to establish the foundational language of medical terminology that you'll use in everyday clinical practice to describe locations, structures, and fluid balance. By the end of this lecture, you'll be able to trace how the body is built from the single cell up to the full organ systems. However, I must have a caveat here. This will be reinforced by your A&P courses, your anatomy and physiology courses. We'll break down 4 primary tissue types, master the terms for when things grow abnormally, learn how to map out the body using planes and quadrants, and finally wrap up with the terminology surrounding body fluids and immune defenses. So let's look at how the human body is organized. It's hierarchical. We start at the chemical level with atoms and ions, which bond to form molecules. These molecules build organelles, the organs of the cells, which give us the basic structural unit of the life, the cell. Cells cluster together to form tissues. Different tissues group together to perform specific functions as an organ, like the lungs pictured here. Organs work together in the body system, ultimately forming the complete organism. The human body is comprised of 11 major organ systems. While we study them individually throughout this program and course, remember that they never work in isolation. For example, your muscular system relies entirely on your cardiovascular system as well as your neurological system, and requires oxygenated blood. And your nervous system regulates your digestive tract. So let's zoom into the tissue level. There are 4 primary tissue types. You must know epithelial, connective, muscle, and nervous. Epithelial, think of this as your lining and barrier. It lines your trachea and forms your outer skin layer, the epidermis. Connective is the structural glue, fat, tendons, ligaments, and cartilage. Muscle is divided into 3 types, including cardiac, which is the heart wall, smooth, hollow organs like the stomach, and skeletal, muscles under voluntary control like your biceps. Nervous is the electrical communication system made up of the brain, spinal cord, and nerves. We need to distinguish between 2 suffixes, plasia, meaning formation or development, and trophy, meaning growth, development, or nutrition. So notice the prefixes a, lack or without, dis, abnormal, hypo, under, below, and hyper, increase or above. Hyperplasia means an abnormal increase in the number of cells. Hypertrophy or hypertrophy means an increase in the size of the individual cells, like lifting weights to grow muscle size. And aplasia is a crucial term in oncology. It refers to a loss of cell specialization, which is a hallmark of malignant cancer cells. Here's a little knowledge check for you. When documenting a patient's position or client's position in a chart or placing them for a procedure, you must use precise terms. Like, let's look at prone versus supine. So prone is lying flat, face down. Supine is lying flat on the back, face up. A memory trick may be supine contains the word spine. You are resting on your spine. Supination versus pronation. This applies to the hands. Supination is turning the palm upward, like you're holding a bowl of soup. Pronation is turning the palm down. Imagine dividing the body along 3 imaginary lines to view internal structures. These are our reference planes. Frontal, which is anterior and posterior, slices the body into front or back portions. Transverse, horizontal, cuts horizontally, separating the upper, superior, and lower, inferior halves. A mid-sagittal, which is median, slices directly down the middle, creating two perfectly equal left and right halves. These roots and prefixes are your anatomical compass. They allow you to describe exactly where an injury or a symptom is located relative to something else. The key examples are anterior, the front, or posterior, back, medial, which is middle, or lateral, which is toward the side. Proximo is near the point of attachment or origin versus distal or dist, which is distant or far away. An example is the wrist is distal to the elbow, but the shoulder is proximal to the elbow. Cephalic, which is the head, versus caudal, which is the tail. Let's look at combining forms that target specific body parts. When you see these roots paired with suffixes later, you'll instantly know what region we are talking about. Acro means extremities, arms, or legs. Blephar or blepharo means eyelid. So an example is blepharitis, which is eyelid inflammation. Cheer or zero means hand, or decto means digits, fingers or toes. Lepero means abdominal wall. So, for example, is the leparoscopy. Let's look at combining forms that target specific body parts. When you see these roots paired with suffixes later, you'll instantly know also what region. So onco is your nail. So oncophagia means nail biting. And pod or podo refers to feet. So you'll see that in podiatrist. Time for a brain break. When a patient comes to the emergency department, complaining of abdominal pain, the first thing a clinician or nurse does is mentally divide the abdomen into four parts using the umbilicus or the belly button as the center point. Please note that the left and the right always refer to the patient's left and right, not the physicians or the nurses. If a patient has pain in the right upper quadrant, or RUQ, we immediately suspect the liver or gallbladder. Pain in the right left quadrant or right lower quadrant points toward the appendix. Fluid balance is critical to survival. Our body water is divided into two primary neighborhoods, inside the cells and outside the cells. Intracellular fluid, or ICF, makes up the largest portion, about 40% of the body weight. This is the fluid trapped inside cell membranes. Extracellular fluid, which also is ECF, is about 20% of the body weight, and it further is broken down into interstitial fluid, which is the bath water surrounding our cells, and plasma, the liquid portion of our blood. The body is constantly shifting water and electrolytes between these spaces to maintain dynamic equilibrium, which is also called homeostasis. Let's build in some medical terms using fluid roots. Look at crine or to secrete, which gives us endocrine system, or hydro versus hydro. Be careful with spelling here. Some distinctions are hydro with an I means sweat, and hydro with a Y means water. Pyo means pus, so pyogenic bacteria builds pus. Sal means saliva or salivary glands. So here's a quick knowledge check. Blood accounts for about 8% of total body weight. If we spin a tube of blood in a centrifuge, it separates into distinct layers based on density. So plasma is about 55%, the liquid top layer. It is mostly water, 90%, mixed with crucial proteins like albumin, globulins, fibrogen, alongside nutrients and waste products. Formed elements are 45%, and the heavy stuff at the bottom. So this includes erythrocytes, red blood cells, and tiny buffy coat containing leukocytes, which are white blood cells, and thrombocytes, which are platelets. So let's apply our word building blocks to blood disorders. So coagul, which is clotting, and plus pathy, which is disease, is any disease or condition that impairs the blood's ability to clot normally, such as hemophilia. Anti, which is against, plus coagula, which is clotting, is a medication commonly referred to as a blood thinner that prevents or slows down the clotting process. Erythrocytopenia, which is erythro, which is red, plus cyto, which is cell, plus penia, which is deficiency, is an abnormally low number of red blood cells, often a driver of anemia. Anemia is an, which is without, plus anemia, which is red blood cells. Hemorrhage is hemo, blood, plus ridge, which is bursting forth, equals severe, rapid, or uncontrollable bleeding. Erythropenia is too few red blood cells. And leukocytosis is leuco, which is white, plus cytosis, which means abnormal. And that's a high white blood cell count, usually indicating the body is fighting off an infection. Thrombocytopenia, which is thrombo, clot, plus cyte, cell, plus penia, which is deficiency, is a low platelet count, putting the patient at severe risk for uncontrolled bleeding. So this is a list of some of the blood terminology with definitions. And here's another knowledge check. So to wrap up today's session, let's explore how our body protects itself. We classify defenses into nonspecific and specific resistance. Immunity is the body's overall capacity to fight off dangerous infectious organisms. Nonspecific resistance is general defenses that protect against any invader. For instance, phagocytosis, where the white blood cells swallow debris, or anatomical barriers such as the skin and stomach acid. Specific resistance is a targeted attack using antibodies created to recognize one exact unique antigen, like a specific strain or virus. So our immune defenses rely on two strategies: nonspecific resistance, which deploys generic barriers like phagocytosis, interferons, and complement proteins that rupture bacteria, and specific resistance, a targeted tactical response. This specific system identifies the unique fingerprint of an invading antigen like a virus or toxin and manufactures a customized weaponized antibody to lock onto it and destroy the exact threat. So this is another way to look at it. Let's trace an active infection step by step. First, a pathogen like bacteria breaches our physical barriers, like a cut in the skin. Once inside, helper T cells act as the alarms of the immune system, activating the adaptive response. B cells are triggered to create antibodies that neutralize the threat. Finally, memory T cells are left behind. They remember that specific invader so that if it ever attacks again, the body will wipe it out before you can even feel sick. So here's a knowledge check for you. And once again, please make sure you're reinforcing these concepts and this content through activities and other reinforcement strategies provided by not only the Leonard book, but also by the Google Notebook that I will share with all of you.